There are 50 million people worldwide with dementia, according to the World Health Organization. Baylor Scott White Temple is a part of a new study called DCARE, and it's not just focusing on those living with dementia, but they're also focusing on their caregivers. 25 News reporter CIERRA SHIPLEY spoke with a patient, a part of the study, and tells us how it's helped her and her husband.
We have to remember those taking care of someone who lives with dementia goes through hardships all on their own. Now, the study DCARE is going to compare the effectiveness of 3 different types of dementia care interventions. Today, we're talking about the health system-based care, and I spoke with Beth Allen, who says she would be at a loss without the support from this study. Beth Allen has been a part of the DCARE study for a year.
He began to have trouble remembering people's names, and he's always been better at that than I have ever been.
Her husband Bill has lived with dementia for 6 years.
Have I fallen? I don't think so.
Working with the DCARE study and the health system-based care, Allen has access to a 24/7 dementia care specialist to help guide her through day-to-day life.
Relieves a lot of anxiety, because you know there's somewhere you can go for answers that are not questions you would ask an MD.
Those diagnosed with dementia is growing. The World Health Organization predicts 82 million will be diagnosed by 2030. As dementia patients increase, so do caregivers.
It's called the 36-hour day, and it truly is that.
Shannon Drew is the lead dementia care specialist with a family history of dementia. She knows how trying the caregiver's task can be.
With the size of this study, we're able to validate how important it is that not just the patient with dementia be followed and monitored, but their caregiver also.
Allen is taking her husband to physical therapy as he's begun to have a hard time with simple motor skills like walking.
It's so close together that he became unstable, and I couldn't get him to move his feet apart.
Although Bill is suffering from memory loss, Allen says he hasn't lost his sense of humor.
He will tell me he loves me, and then he'll say, "Well, are you going to keep me?" And I'll say, "I don't know." He says, "I'll be good," and I say, yeah, I've heard that a lot.
Bill's memory may be getting worse, but Allen won't stop caring for him because of that commitment she made 60 years ago.
Because I married him. You know, you play the hand you're dealt.
Allen says she wouldn't know how to handle day-to-day life without the help that DCARE has brought. And tomorrow we'll be focusing on the community-based care side of the study, as this caregiver has to live without her husband. In Temple, CIERRA SHIPLEY, 25 News.
CIERRA, thank you. If you know someone struggling with dementia, you can be a part of that study. Baylor Scott White Temple is hoping to enroll 500 to 700.